Hey, everybody. Welcome to today's Teletown Hall. This is Congressman Mike Gallagher. I want to start by thanking each of you for joining the call. In particular, I want to thank our special guest joining the call, the Wisconsin State Department of Health Services Deputy Secretary Julie Willems Van Dijk. As I'm sure you know, we're here today to answer any questions you may have on the coronavirus outbreak, and we're very grateful for Secretary Van Dijk for joining us. And as you're a member of Congress, I view my primary role in situations like this to be a resource of information at the intersection of the federal government and the state government. And in tonight's call, I hope you will have a better understanding at the end of it of the coronavirus response from the federal, state, and local effort. A joint effort from all levels of government is critical to responding aggressively to this outbreak. I know there's been a lot of information about the virus both in the U.S. and abroad, with 2 new cases confirmed in Wisconsin. We really want to make sure we get the right information out there, and both I and Deputy Secretary Willems Van Dijk want all of Northeast Wisconsin to feel prepared and reassured in our state's ability to manage this health crisis. So before we get started, let's go over some quick housekeeping rules. If you'd like to share your opinion or ask me a question, press *3 on your phone. That's *3 to ask a question or share a comment. And if you'd like to stay up to date on what's happening in Congress and any legislation we're working on in this space, press *0, and you'll be able to join our email newsletter. So while we wait for people to join the call, I'll give a quick update. First, and again, if you want to get in line for a question, press *3. And since we are lucky to have the expertise of the Deputy Secretary, I am going to try and talk as little as possible tonight and make sure she has a chance to talk. But I just want to quickly stress how seriously we are taking this challenge on both sides of the aisle. Last week, for example, we passed a bipartisan $8 billion emergency funding package that President Trump quickly signed into law. Just today it was announced that of the nearly $700 million going to state and local efforts from the CDC, Wisconsin will be receiving over $10 million to help our officials. This is in addition to the initial $1 million Wisconsin received earlier. But let's make no mistake, our role here is not done. We have to continue to aggressively do all we can to keep Americans safe. The FDA has recently announced eligible private labs to conduct testing and hopefully will expand testing capabilities at the state level. I'm aware of recent reporting regarding inadequate supplies to extract genetic material from patient samples at these testing facilities. The FDA and CDC are working quickly to approve new testing methods to mitigate that, but I'm interested tonight in hearing what more do we need to do. My initial take, and I'd be curious if the Deputy Secretary agrees, is that if you look at the countries that have combated this successfully, whether it's South Korea or Taiwan, rapid and exponential growth in testing has been at the key to those efforts, combined with individual resilience and social distancing. So this is a partnership between the state and local government. And again, I just want to thank the Deputy Secretary for being here. One final thing, and I know this sounds silly, but I can't stress how important it is at the level of individual resilience to wash your hands for at least 20 seconds. You want to do everything you can to do basic hygiene to increase your resiliency. And if we can increase our community resiliency, we decrease the likelihood of putting undue stress on the healthcare system. And so just wanted to stress that fact. For those just joining the call, this is Mike Gallagher. I'm joined by the Wisconsin State Department of Health Services Deputy Secretary Julie Willems Van Dijk. And she and I are here to answer your questions and provide information about the coronavirus outbreak. If you want to ask a question, press *3. That's *3 to ask a question. And so with that, let me introduce Deputy Secretary Van Dijk, who most recently served as Director of County Health Rankings and Roadmaps, a national collaboration between the University of Wisconsin Population Health Institute and the Robert Wood Johnson Foundation, where she was involved in providing data, evidence, and guidance to over 3,000 counties who are building a better culture of health. And prior to joining the Institute, she was the Marathon County Public Health Officer and served on the boards of Aspirus Wausau Hospital and Bridge Community Health Clinic, and as an elected member of the Wausau School District Board of Education. The Deputy Secretary earned a Ph.D. in nursing from the University of Wisconsin-Milwaukee and is a fellow in the American Academy of Nursing. And so I want to thank her for joining us, and I will give it over to her for some initial comments.
Thank you so much, Congressman. And first off, I have to thank you and your fellow congressional representatives on passing that funding bill. It is so critical in a crisis like this, and we so appreciate the bipartisan support that has been demonstrated by the Congress and the President to bring us to this point, to secure an initial batch of resources to help us with our efforts here. We're working very hard for the people of Wisconsin, and this is a crisis. As many of you may have heard today, the World Health Organization has officially labeled the coronavirus, or COVID-19, as it's now been officially named, a pandemic. And what that means is a couple of things. One is it means this is a new virus, and secondly, it means it has spread widely. It has to meet certain definitions about how many continents and how many countries and how many people have been infected by this. And unfortunately, we have reached that pandemic level. Because it's new, this is why this is so serious. Because it is a brand new virus, that means no one in the world had immunity to it, and we have no treatment or vaccine for it. The good news is we live in a great nation, a great world, and there are scientists as we speak working on vaccine and testing medications that we already have available. There are clinical trials underway for what might work against this disease. However, if you know much about viruses, you know they're tricky little critters to treat. And so medication is often not the most effective route. The best route to treat viruses is to get a good vaccine that will produce immunity so that you don't get the disease in the first place. Unfortunately, we're probably at least a year out from a vaccine, and so that's why we have to take other measures between now and then to control the disease. Let me take a moment to say what this disease looks like. It usually begins with fever and with cough and with shortness of breath. Sometimes you might also have a runny nose or a sore throat. But fever, cough, shortness of breath are the most common symptoms. Now, here's the problem. What else does that sound like? Influenza, right? And we know this has been just a terrible influenza season, and we are on our second wave of a very high rate of influenza. So part of the challenge here is to sort out who has just plain old run-of-the-mill seasonal influenza and who might have this new disease, COVID-19. And so therefore, what the congressman just mentioned is so essentially important is we are working very hard to increase testing here in Wisconsin and across the nation. In Wisconsin, we have 2 public labs that are conducting testing for the disease, the State Lab of Hygiene here in Madison and the Milwaukee City Health Department. And we became aware this week that a couple of private labs have come on board, and all of this is going to help us greatly expand testing. We have also expanded the criteria for who can be tested, and so basically, if you are experiencing these symptoms, you need to call your physician, your healthcare provider, let them know you're experiencing symptoms, and then have them direct you as to whether it makes sense to come in and get tested, and if so, how they want you to enter the clinic so that you wouldn't expose other people. Because of the increased testing, both here and across the nation, we are seeing many more cases. I forgot to pull the latest data. As of yesterday, we had 647 cases in the United States with 36 deaths in 36 jurisdictions, including D.C., although I know that's at least 37 because I know Michigan was added to the list last night. Right now, 2/3 of our cases are in 3 states. They're in Washington, California, and New York. And so those states have very high incidence of the disease. However, we're seeing spread continuously in other states, including all the states that surround Wisconsin. Just an hour ago, we announced that we have 3 more cases in the state of Wisconsin. This is hot off the press. You are hearing this probably before the news is even out. And those additional cases are in Waukesha County and 2 cases in Fond du Lac County, so in northeast Wisconsin. Our local health departments are our partners in controlling this disease, and I have to give a shout out to our local health officials. They are on this, and they are the people who are responsible when there is a case in their community to contact that person, to assure they are staying in isolation, to interview them and find out who they have been in contact with, and then to make notification to those folks to let them know they need to also, depending on their exposure level, move into a 14-hour self-quarantine situation and also monitor for signs and symptoms of the disease. So this process of identifying people who are ill, of course getting them care in the hospital if they need it, but luckily about 80% of the cases are fairly mild and can be treated at home. Making sure people are isolated and making sure then we quarantine their close contacts so that they don't develop the disease and spread it further is one of our most important tools right now. As we continue to see spread in Wisconsin, and based on the fact that we've gone from 1 case to 3 cases to 6 cases in the last couple of days, we anticipate we'll see more. The other mechanism we have right now is what the congressman mentioned, which is social distancing. And that means quarantine and isolation, but it also means we may need to do things in our daily lives to decrease how much we are gathering in public spaces. And so we are evaluating the situation right now and making recommendations about where it makes sense for people to come together. Right now, here's what I'd say to you. This disease is most serious for people who are over 60 years of age or people who have another chronic condition like lung disease or heart disease or diabetes. And so if you are a person in one of those categories, probably now is not the time to go on a big trip. Now is not the time to spend a lot of time out in big crowds. I would say tighten up your social circle. I don't want you to become hermits, but I think those older adults and people with chronic diseases are really well suited right now while we get a handle on how much this has spread to stay close to home or in fairly controlled settings without tons and tons of people. And I'll end before we turn to questions by reiterating what the congressman said. The other way you can protect yourself are the good old things your mom taught you when you went off to kindergarten. Wash your hands, wash your hands, wash your hands. When we say wash your hands for 20 to 30 seconds, you don't really realize how long that is. So pick a favorite song. I used to tell my kids to sing the ABCs while they washed their hands. That will work. If you'd rather pick a different tune, pick that. And make sure you scrub them up good, get between your fingers, under your nails, and do this over and over during the day, not only after you use the restroom, but after you touch things like doorknobs or elevator buttons or grocery carts or things like that where you may have touched surfaces where sick people might have touched them. Don't touch your face. This is the hardest thing. This is harder than washing hands. But by touching your face, if you do come into contact with the virus and then you touch your nose or your mouth or your eyes, that's how you will introduce it into yourself. If you have a cough or a sneeze, cough into your elbow or into a tissue. Don't cough into your hand because the disease is spread by those respiratory droplets. So you want to cover your cough. And lastly, if you're feeling sick, if you have a fever, a cough, stay home. Don't expose others. Don't go to work. Don't go to school. Even many of us who think we're really tough and we can tough it out, the important thing to remember right now is We not only owe it to ourselves to take care of ourselves, but we owe it to everyone else in our community. And we just can't let this get like wildfire in Wisconsin and put our older adults and people with chronic conditions at risk. So it's our responsibility, each of us, to protect our own health, but also the health of our friends and our family and our neighbors by following these precautions. So let me stop there, and we're happy to take questions.
Fantastic. Thank you for that. So again, it's *3. If you want to ask a question, just press *3, and we'll get you in the line. It looks like our first question is going to come from Neil Shadle. Forgive me if I mispronounce your last name, from Washington Island. Neil, what's on your mind?
I was just curious to know about the quarantine strategy, whether this would be households or communities, maybe job sites. What are we thinking about in that regard?
Absolutely. I just would say from a federal level, my perspective, and I'd be curious if the Deputy Secretary agrees or disagrees. I think we're already at a point where while each county is going to have to make their own decisions about what guidance they're doing, I certainly would recommend canceling any major event that is, more than 150 and certainly 200 people. I've already called for, here in Congress, I think we should close down for visitors. We should remain in session with members and essential staff, but certainly people in public office, I think, mayors and whatnot are going to have to make hard decisions about St. Patrick's Day parades, but I think we should already close those down. And in terms of social distancing, we're all going to have to make a judgment about how do we not completely isolate ourselves, but how can we limit our interaction with large groups of people? For fellow Catholics in the audience, I've been in touch with the bishop and a few others, and the church is still updating its guidance about whether or not people should attend every week, so I don't have any news to offer there, but I turn it over to the Deputy Secretary to see if there's a more official quarantine strategy should this continue to grow exponentially.
Right. Well, Congressman, you're right on board. How we're beginning this is with individual cases and doing home quarantine with those cases. And I have to give a great shout out to our fellow Wisconsinites who've been infected with this disease. They've been so cooperative about this. They understand the risk they pose to their family and friends, and they've just abided by those quarantines very well. I will say if that situation would change and we would have people who were not following the isolation and quarantine rules, local health officers and our state health officer do have the legal authority. That's why they're called officers, to go to court and order quarantine, and there are penalties if you violate that. And then as we move into thinking about how we can stem the spread of this disease, I agree with the Congressman. Actually, we are having some meetings immediately after this town hall here at the Department of Health Services to have further conversation about our guidance around public gatherings. But I think you will start to see recommendations for eliminating those public gatherings with larger groups of people, 150 or 250. And again, I just can't say enough about, in the meantime, those who are at higher risk, trying to stay closer to home. This will be disruptive, we know, but we really believe if we can keep people from transmitting this disease to each other, we will have slower spread of the disease. And this is really important because if we start to see more people having the disease, we don't want thousands getting it at the same time, and then many of those needing hospitalization and overwhelming our hospitals. So we'd rather see slower spread of the disease, and that's what these strategies will affect.
Can I just foot stomp something you said earlier, and share a personal point on this? Mm-hmm. We should already be limiting extraneous, unnecessary travel. Unless you absolutely have to fly somewhere, I think that what I'm hearing from the experts is don't do that. My wife and I canceled a couple of trips already, and so we're trying to just eliminate all necessary travel. So I think we should all focus on the variables that we can control, from personal hygiene to limiting personal travel to limiting extraneous interaction with large crowds of people, and avoiding handshakes as well.
Very good. Yeah.
Next question goes to Rebecca. Rebecca has a question on ventilators. Rebecca, you still there?
Yes. Oh, I'm sorry. I thought it would be red. My top concern is with the supply of ventilators and hospital beds, and if there is a concerted effort underway right now to order more equipment or repair old equipment or otherwise beef up the supply of all the materials that are going to be needed, because it is such a bad flu season also. It seems that we're headed into a real problem at the hospitals not having enough beds and equipment for all the possible patients that could show up, even if it's slowed down with the bad flu season. So what is being done on this? I've been trying to find out for over a week, and I haven't really found out yet.
Mm-hmm.
Secretary, do you have, is there data available that we have about what that supply looks like from a statewide perspective? I can share anecdotally what I've gotten in conversations with the hospitals in Northeast Wisconsin, but I'd be curious if there's an official word on that.
Our Division of Public Health works very closely with the Wisconsin Hospital Association, and they have databases that do monitor hospital utilization, isolation rooms, ER utilization, and so there are good data systems in place to know where we're at in terms of census in hospitals and utilization. And we are working with them to talk about ways that we can provide mutual aid across hospitals across the state. The other thing that I know our hospitals are beginning to think about is and actually already have, because as you mentioned, Rebecca, the influenza season has been really challenging, and they have had many, many admissions related to influenza, is another strategy that they can use is eliminating optional or surgeries or admissions to the hospital that could be delayed until later. And so that's another important strategy that we will look at as we move forward. And I do not have a specific answer on if people are looking at ordering more ventilators. I know there are some equipment opportunities available through the Strategic National Stockpile, and the other option that we have to enhance our workforce is also the governor could call up the National Guard and secure additional healthcare personnel through that mechanism. But Congressman, what else have you been hearing?
I think I've talked to every major hospital in Northeast Wisconsin, both from the physician level and the administrator level, and then the county health officials. I think it's fair to say there is a concern about the availability of not only ventilators but just basic, protective gear. I forget the term of art for it. Masks, really. Mm-hmm. The N95 mask, the surgical mask, is the one they're most concerned about. The CDC has said don't go online and buy masks, and certainly there have been people going into hospitals in Northeast Wisconsin and trying to take masks. Please do not do that. It is not necessarily an effective way to limit the spread unless you are severely ill and you're robbing resources from the hospitals and people on the front lines who really need that. You mentioned the strategic reserve. We have that. But again, that would have to be spread across 50 states, all of which have different needs. So I think it's fair to admit that we don't have the necessary resources in the event it got very bad, in part because our manufacturing capacity for a lot of these key items has moved offshore in the last few decades. And the irony is we make a lot of this stuff in China. And so myself and Congressman Pocan introduced a bill that would fix that over the long term, but that's sort of geared towards the next crisis. And really we need to be looking at ways in which we can be able to ramp up production quickly in the United States one thing we're debating in Congress is whether we provide some legal protection for manufacturers of ventilators and other equipment so that they are not sued as they try and rapidly scale up production to prevent a shortfall. Thank you for the question. We're going to go to *3 if you want to ask questions. *3 if you want to get in line to ask a question. Our next question is from Mr. Montour. Montour, I'm sorry if I'm mispronouncing that.
Yeah, Montour.
Montour. Okay. What's on your mind, sir?
Well, what I'm looking at is it seems like we're making a whole lot of panic over nothing. Like she already discussed that the flu season's already killed thousands. You don't hear nothing about that. You still got to do all of the things to not get the flu that way. I mean, in the eyes of the idea that there's no vaccine and they're rapidly developing one, I just don't see where the great panic in this is, for the simple fact that the cases she said have been mild. I guess I'm having a hard time wrapping my head around the fact that this is worse than the other one, other than the fact that you can be contagious without any symptoms, but yet the cases we're getting are mild, except for those that are vulnerable to begin with, which are still the same ones that are vulnerable for the regular flu in this season. So I guess it just seems to me like if it's bad for the orange guy in the office, then we're going to make this worse than what it is. I mean, how far out am I on this?
So great question. So the differences between the regular flu and the coronavirus, Deputy Secretary, could you walk us through that?
Sure.
Based on what we know now.
Sure. So you are absolutely right, sir, that the regular flu has killed thousands, and in any given flu season we lose 60, 70, 80,000 people to seasonal influenza. But here's the really key point I want you to focus on. That happens even when we have a flu vaccine that somewhere between 60 and 70% of us get every year. And so we're losing that many people against a disease where we actually have a vaccine. And this disease, we have no vaccine to protect us against. And so even if you think about 330 million Americans, and disease is mild in 80% of them, that still puts us, with 60 million people, if everyone got infected, who could be critically ill. That's a lot of people. Now, so I think really the critical point here is that this is a new virus. We don't have any protection against it. We don't have a vaccine, and we don't have medication. So that's why I see it as a major issue that distinguishes it from influenza, because we lose enough people to influenza even when many of us are protected by vaccine.
Do we know enough to know whether it's more infectious than influenza? As I understand it, there's really two ways to measure it. One is the infectious rate, or the R naught rate, and the other is the case fatality rate. Basically, how deadly is it?
Right.
I know I've heard different numbers of the last 3 weeks. Is there any number on both of those measures that you feel confident in at this point?
Yeah, I do not know that either of those are still things that we are learning about. And it appears that it is pretty infectious. I don't think it's as infectious as something like measles, which is one of the worst.
Yeah.
But it probably, I would be hypothesizing, so I won't go there. And I think the other thing about the case fatality rate, because you hear lots of people calculating that and hypothesizing about it, and the real reality about that right now is until we do way more extensive testing, we won't know what the proper denominator is for calculating a case fatality rate, because we don't know how many people have been infected with very mild symptoms that might not have even known that they have it. And so another important piece of this that I think it's really important for us all to remember is we are still learning as we go here, and many of these questions will be answered better over the next weeks and months.
Sure. And then I just would say to the broader sort of thrust of your question, Mr. Montour, my my posture and messaging has been, I agree we shouldn't panic, but we should prepare, right? I mean, in the Marine Corps, we'd say you hope for the best, prepare for the worst. So there's a lot of misinformation out there online and on Twitter, and I think there is an impulse among some of my colleagues to try and politicize the issue or blame this person or that person. I'm of the mindset of, let's do everything possible we can to be as prepared in Northeast Wisconsin for the worst while we hope for the best and avoid outright panic. So that's what this is all about. Next question goes to Maureen from De Pere. Maureen from De Pere.
Hi. My question concerns the caregivers that are at risk. In follow-up to Mr. Montour about how transmittable this is, one patient in New York on Long Island infected over 40 doctors and nurses in the emergency room, and I have a daughter in my family that's a nurse. So is there any plan for testing people outside the hospital and outside your doctor's office? If you walk in with symptoms, you are infecting other people if it's that transmittable in the lobby waiting. And in other countries, they have set aside separate places. Australia has them. I have two sons living down there, where they actually do not test them on site. If you have symptoms that match the symptoms for this virus, they test them outside so as not to infect healthy people. Any plans on that?
That's a great question, and I can tell you a couple of things. First of all, there are several places in the state that are talking about doing mobile testing. You've heard some places talk about drive-through testing. I know there are some other states that are setting that up as well. And part of this was we had to get our testing capability up to speed because you didn't want to set up those places unless you had enough test kits to actually test the samples, and thankfully we're getting in a much better space on that. So I think you may see more of that. The second thing I would say is our healthcare systems here in Wisconsin have been just doing a fabulous job about thinking about this and screening for it and not putting either healthcare workers or other patients in the kind of situation that we heard about in Long Island where so many people were exposed. So that includes things like if you've been to the doctor recently, I'm sure they have one of the first questions they have asked you is, do you have a cough, and have you been out of the country, or have you been with anyone who has been out of the country? And so if you answer yes to any of those things, you will immediately be masked and often put in a room as soon as you can be. And these are really good measures to protect both other patients and caregivers. So I want to give a shout out to our healthcare providers in the state who have learned from previous outbreaks like Ebola or H1N1 to ask those screening questions and protect people right away.
Great. And I would say in talking to the hospital systems, the thing they talk most about is testing, but there is a desire to be able to do more telemedicine, particularly if you have initial symptoms and you call in. Our hospitals need the ability in some cases to have antitrust relief so they can do virtual visits and not charge for those virtual visits. And so that's one thing I think we can do to limit the spread. We're working on giving our hospitals the relief they need to be able to do more over the phone. Obviously, if you need to get tested, or you might need to come into the hospital. But Julie, if I think what you said at the beginning of this is, if you are feeling symptoms, your first impulse shouldn't be to drive to an emergency room or hospital, but rather call your physician. Correct?
Exactly.
Okay.
And that also will help. Then they'll be ready for you coming and be able to usher you into a room right away, rather again than have you sitting out in a waiting room.
Right. Our next question goes to Shirley from Marinette. Shirley.
Yes. I wanted to know if there were any kits that are north of Green Bay up to Marinette County in the hospitals and so forth in case somebody did have the symptoms.
Great question. Julie, do we know what the status is right now of the test kits and where they are?
Yeah. Well, here's the deal. Any clinic in any any place in Wisconsin can take the sample for this test. It's a simple nasal swab and oral swab, kind of just like if you got strep throat and they put that awful cotton swab back in the back of your throat. That's how you test for it. It's put in a test tube, and I don't know that there's any labs up north that are testing for it right now, but that specimen can then be transmitted to any lab in the state that is doing the testing. None of these tests are being done on site in a clinic where they're collected. They're all being sent to other labs. And the great thing is now with the state lab on board and the Milwaukee lab, and now as we are seeing private labs in our state bring this on, we're getting much quicker test results. In the early weeks of the outbreak, we had to send all the samples down to the Centers for Disease Control in Atlanta, and it was taking 7 to 8 days to get results, and we are bringing that back down to 1 to 2 days at the most.
Do we know where the private labs are? Sorry to put you on the spot there. I just don't know the answer to that question.
I don't know where they are.
We'll get an answer on that and provide it later. But thank you. Wendy from Green Bay.
Hi. I have a question in regards to some of the things that we've been hearing that Trump is saying that they're going to be putting these stimulus packages out for people, for people that work, they don't have to pay taxes, things like that. My question is, what about the people that don't work, that are on disability or trying to get on disability and can't work at this point, and may not have health insurance? Are they going to be able to be tested? And what's going to happen with that? And what really happens to those people that have no money, that can't afford to go out and buy, jugs of Purell and cleaning supplies, up the wazoo?
Yeah. So I'll be honest with you, as a rank and file member of Congress who's been following this closely, there have been discussions going on about a stimulus package, but those have been entirely at the leadership level. So there is negotiation going on between Speaker Pelosi and the White House and the Senate, but we, as in the broader members of Congress, and I think my Democratic colleagues would say the same, have not been invited into that conversation, which admittedly is very frustrating because I think we need to think very strategically about the type of behavior we are trying to incentivize with the stimulus. It's not clear to me that a short-term payroll tax cut would get you the type of behavior that would limit the spread of this disease and allow us to defeat it more quickly. In other words, it might provide a short-term sugar high to the economy, but our primary concern needs to be health. And the quicker we're able to limit and mitigate and ultimately defeat the disease, the better off our economy will be in the long term. So one thing I said today, just kind of when asked point blank on TV, was I actually think we're about to go into recess tomorrow in Congress and presumably leave for a week and a half. That to me makes no sense. I mean, we should be in session with our essential staff debating what the right stimulus package, if any, is, and it certainly should be one that's focused on people that are most vulnerable to this disease right now. So that's not a good answer to your question because I quite honestly don't know what is being negotiated right now between the small group of people who do this, but I think we need a broader debate in the Congress and a real targeted approach that actually incentivizes the right behavior and isn't just about juicing up stock prices for a limited period of time. I mean, all our efforts really need to be focused on rapid testing, community resilience, individual resilience. I think that gives us the best chance of recovering more quickly, and the economy will do better the quicker we recover, if any of that makes sense.
That sounds really reasonable. And I would just add a couple of things, Wendy. People who get testing at the State Lab of Hygiene, that testing can be provided for free. The State Lab is your public health laboratory paid for with your tax dollars. And so for people who need testing, this is a great place to call your local health department and help arrange that. People may still need to pay their physician for the visit to collect the test results, but the test itself, which we've heard ranges from $200 to $300 at a private lab, can be provided free of charge at the State Lab of Hygiene. We also know that when a vaccine is developed, it will likely be available to citizens, again, free of charge because of the public health benefit of that vaccine. The other thing here in Wisconsin, the governor spoke with the insurance commissioner, and he issued guidance to Wisconsin-based health insurance plans and was asking for their cooperation in waiving deductibles and co-pays for charges related to COVID-19 so that we didn't have people, I hear you about people who are disabled or people who don't have insurance, but even people with insurance now often have very high deductible plans, and we didn't want people staying home and not going and getting tested if they needed to because of their high deductible. And so the Wisconsin insurance plans have been working very closely with the Office of the Insurance Commissioner on that.
Kathleen from De Pere. Kathleen, are you there from De Pere? Kathleen, I think Kathleen had a question about school closures. And I guess in the absence of Kathleen, maybe I'll just ask because I'm curious. I know most UW schools are closing down and going to virtual classroom instruction. When it comes to, I guess, does the department have a considered view on that? If the local school districts asked for guidance from the state, would you provide that? Is that just a city-by-city, school-by-school decision in partnership with the parents? What's the best approach there?
Yeah, that's a great question because, of course, as soon as we start talking about mass gatherings, where do we gather our children? Every day is in school, right? So a couple of things. For sure, we've been working with the Department of Public Instruction, who has been sharing guidance with school districts across the state. And I think this consultation will be ongoing and evolving. I think there's a little bit of a difference when you look at K-12 schools from universities in that universities have gotten much farther along in their development of online education and how they can substitute classroom-based education with online education. And so we don't necessarily have that same ability to the same extent with K through 12 schools. And so we know education is really important, and we have to balance health and education. The other thing we know about this disease is that kids are they are some of the lowest risk groups of this, which is the exact opposite of influenza right now. Influenza this year is affecting children more seriously than it has in past years. So our kids are not our highest risk group right now. We also know if we close school, where do the kids go? And often, if people have to keep going to their job, where do you send your kids? To their grandparents. And who is most at risk for COVID-19? Grandparents. So we have to balance all of these things. Now, clearly, if there is a case in a school, in either a staff member or a student, that is going to change the equation for that school district. And if we start to see widespread dissemination of the disease in a particular community, that is also going to change the equation. And so those are the kinds of things that we are working with our colleagues at DPI in consultation with local communities when we have cases that might affect a school district, talking with the local superintendent and making those decisions.
Thank you. I think we're running out of time. Maybe we have time for one more question and some closing comments. The next question goes to Dalton from Marinette. Dalton from Marinette. Dalton, are you there? Okay, Dalton is not there. What about Rose from Brussels? Rose from Brussels.
Yes, this is Randy.
Rose. Hi, how are you?
Very good.
What's on your mind?
About the kids with their school, with that vaccine. Does that help or not?
Does the vaccine help? Is that your question?
Yes.
Well, I think certainly a regular flu vaccine still helps for your yearly flu, which is a problem. And part of the reason our hospitals are stressed is because this has been an unusually bad flu system. But I believe the Deputy Secretary said earlier that part of the problem is we don't yet have a vaccine for COVID-19, and it may be a year until we get one, and so we don't have a vaccine right now, and that's part of the problem. Is that correct?
That is correct.
Okay, well, we are running out of time, and I want to give the Deputy Secretary some time if she has any other thoughts or things we didn't cover that you think are essential. Julie, I turn it over to you.
You bet. I would just re-emphasize a couple of things that we have talked about here, too. First of all, this is a new disease, and we are learning every day. And so the fact that sometimes you'll hear one thing one day and then a new recommendation the next day is going to happen here. It's going to be because we are learning new things. And so I really encourage people to come to dhs.wisconsin.gov. That's the Department of Health Services website. On our homepage, we have a big coronavirus picture, and you can click on that and get lots of information on all of the latest information. Also at cdc.gov, that's the Centers for Disease Control, you'll find reliable information there. Our communications team is working very hard to get information out to the media. We want to be your trusted source for information on this. We know there is a lot of confusing information out there, and so we've been very open with the media, and they've been very interested in this. So your Wisconsin-based media is doing a fabulous job of covering coronavirus issues and how they are affecting our state. So keep reading our local news as well, too. And then finally, just thank you to everybody who is doing what they can do to prevent the spread of this disease, washing your hands, covering your coughs, staying home when you're sick, and supporting your older adults in your family to be sure that they're taking proper precautions to avoid the disease. And I know Wisconsin people are resilient, and we know how to hang together and take on big problems like this, and we will do so. So thank you all for everything you do to prevent the spread of this disease. And as you have questions, do not hesitate to reach out to the Department of Health Services, and we are here to answer your questions. Thank you, Congressman, for hosting this town hall. We appreciate your leadership.
Well, thank you for your time. We're really lucky that you were able to do this. Appreciate the information. We are interested in our office in figuring out what is the best way we can share information going forward and make sure that we can minimize the amount of disinformation that's out there. So if you want to share your thoughts, feel free to stay on the line or press *0 to do that. You can share your thoughts with our office. I just would like to foot stomp a few things as we consider what more resources we can provide at the federal level. Certainly the issue of exponentially expediting testing is something I've heard consistently from physicians, from hospitals, from state officials, local officials. I want to do everything possible in my position, and where necessary, if I need to put pressure on the federal government or wherever to expedite testing. I just believe, having watched the responses in various other countries, testing is the best way that we can get a handle on this and correspondingly prevent misinformation. But as the Deputy Secretary outlined, as Wisconsinites, I mean, there are all steps we can take in terms of individual resilience that range from just basic washing of your hands, making smart choices to minimize your interaction, canceling unnecessary, non-essential travel, and just helping out your neighbors that may need help, particularly if they are symptomatic, or someone needs you to go run and get some groceries for them. There are a lot of ways where we can just, through basic Wisconsin decency, mitigate the spread of this disease. And so I really want to thank the Deputy Secretary for being part of this cause. And again, my whole approach to this, and I think the approach of a lot of people right now that may not get it reflected in the media every night, because we are in an election year, is we shouldn't panic, but we should prepare, right? You hope for the best, but you plan for the worst. Don't panic, but prepare. And if we have that mindset, I think we have an opportunity really to prove our resilience in Northeast Wisconsin. And we are lucky. Year after year, Wisconsin ranks at the top or in the top 3 in terms of the quality of our healthcare system. And there are a lot of dedicated professionals at all the hospitals in Northeast Wisconsin who are working around the clock right now to figure out how we can be best prepared in the event of the worst case scenario. But hopefully we can take steps now to avoid that. So again, I just want to thank the Deputy Secretary for joining us. Thank you to everyone who joined us. I really appreciate it. And again, if you want to share thoughts with our office, please stay on the line, or you can click *0, or you can visit www.gallagher.house.gov. That's www.gallagher.house.gov. Thank you so much. Appreciate it.